Most people wait until something's wrong to see a doctor. You are not most people. I'm Kevin White. After more than 20 years as an emergency physician, I realized the best medicine is not waiting for the crash. It's helping people stay on the road. This is The Daily Apple, a podcast about living better, longer. Every episode gives you something you can use this week. A smarter habit, a clearer path, or maybe just a new way to think about your health. Because engaged patients are the best patients, and your best years do not have to be behind you. Let's get into it.
Hey everyone, welcome back to the Daily Apple. I'm really kind of psyched about this conversation. I'm going to be talking to Travis Bond, MD, MBA. I just threw all the letters back on your name. I know how you love that. And then who is the CEO of BioInsights. And we're going to talk about data getting back into the hands of the patient. And we're going to talk about why that's important. Talk about where he comes from. Like we were just talking about off camera, you're definitely a different breed of cat for sure. And some work you've been doing with DC and kind of changing the way we look at all this stuff in the future. So it's really future driven. And I know when we met in Colorado, I was just, after hearing your story, I was like, I've got to talk to this guy. I just want to be friends with him and see what he's up to. So, dude, thanks for making time. I appreciate it.
Hey, thank you. Appreciate it.
Yeah. Well, we're going to be talking about BioInsights. We're going to be talking about some cool stuff you just recently have been doing in Washington, D.C. with the government. And I want to get into that. But before we do that, I kind of want to get into your origin story. I mean, it's kind of cool. It's different. And it says a lot about you. So, say more on that. Tell me about it.
Yeah, I appreciate it. And I want to take several minutes to sort of unpack this because I think it is central to the motivation, but I think it's also a good story that really nails home the point about the blind spots in Western eyes or allopathic medicine. Mm-hmm. So specifically on January the 18th, 2018, only 3 months after my wife's younger sister had passed away from metastatic cancer and had 2 teenage boys that we adopt. So we're already kind of in a sort of chaotic state. My wife calls me and says, everything's going to be fine. We're okay at work late in the afternoon. I'm like, what does that mean? And then she said, the house is on fire and the fire trucks are on their way, but we're outside standing by the mailbox like we always talked about if the house was on fire. So I'm like, wow, okay, it was just 3 days ago we buried your sister and adopted 2 kids, and now we have 7, a lot going on. And so 9 months we lived out of a suitcase and, cardboard boxes. And then we moved in. And then, it's kind of like, okay, this is, kind of getting up on the Christmas season again. And, life is back to normal. And about 4 weeks later, my wife was just climbing the stairs. We have a 2-story house. And she literally sat down at the top of the stairs and she could not breathe. I mean, she looked as though maybe she had the flu or something because she was sweating and she was out of breath. I'm like, my goodness, what is wrong? Another 6 months went by, Kevin. She went to, I think it was 19 doctors, 26 visits, and 13 procedures. And the final visit was Tampa General Hospital working her up for a double lung transplant. She's a 49-year-old, natural mother of 5 plus 2, and otherwise healthy, and completely had blindsided all of Western medicine as to what was going on. And the only clue that we were given in all those providers was one old guy, a pulmonologist, the one that probably started his career by going to people's homes, right? Before we had this sort of centralized, you come to me as a patient. And he kept asking this silly question, do you have birds at home? And we don't, by the way. And we have 2 dogs and they're hypoallergenic, right? So we even dust regularly. I mean, we have a very clean home. And then I was working in New York at the time. And I was literally just sort of sitting, overlooking the Hudson, reading my Bible. And literally the words popped into my mind, did you check the couch? And I'm like, So I text my wife and I said, hey, just, for whatever, grins and giggles, go look at the tags on the couch. And she took a picture and what popped up was 100% bird feathers. Oh. So the couch that she had been laying down to rest on during the afternoon because she had no energy was literally putting her face into what is otherwise an environmental toxin. But all of these providers could not figure it out, right? So to me, that was a solid data point to say I was literally months away from my wife using somebody else's lungs. Yeah. And if you know anything about 5-year survival rate, it's single digits. So, I mean, needless to say, I'm 5 years away from being a widow.
Yeah.
This is pretty serious. And so that was like, so all these doctors that are highly educated, highly specialized, were basically bested by a couch from Pottery Barn, for lack of a better word, right? But one old guy, had seen enough patients to recognize that sort of pattern.
Was she just having a
Then,
reaction to the birds, or?
yeah, it's called bird fancier's disease, and some people just have, it's not an allergy, it's a sensitivity to the natural sort of microbes that are on a bird's feather. Like we have little bacteria on our skin that sort of helps clean it off when it dies and so forth, right? So the
Yeah.
birds have somewhat of a similar parasite bacteria. So we got rid of the couches. 6 months later, she was on, steroids and so forth, and she's better. But
And let
that
me
sort of
back
started.
up for a second. It's important to know that even so, a lung transplant, as you and I know, or anybody listening, or many people who are listening don't understand that, a renal transplant's a different breed completely. But you talk about a lung transplant, that's a lot more. The outcome isn't as clear for that. So you're absolutely
I mean,
right.
it's
That's
very invasive. It's a very
yeah,
invasive, right? I mean, similar to the kidney, all the blood in the body will
yeah,
go through the lungs, right? And
yeah,
so now you're talking about immune suppression. You're
yeah,
talking about post-surgery infections and risk, right? And you're talking about immune suppression that could lead to a host of other things, right? And we're sort of literally just coming up. We didn't know it then, to COVID. So you could have had somebody that would have been highly vulnerable to the COVID infection
yeah,
respiratorily. If she would have gotten COVID, I seriously doubt she would have made it through. So
yeah.
I think that that's kind of part of my first sort of three strikes, if you will, that really kind of, I think, changed the sort of trajectory of my life. The second one is that she's now more health conscious. So she sees a functional medicine doctor sign near our neighborhood, drives in, and she had suffered from PCOS and other things that are sort of hormone based from her teenage years, right? And so she's always had very horrible periods. They last like 10 days. She would get very anemic. I mean, things that really couldn't be treated. She had endometriosis. And every time, she would give a live birth, she'd have bladder infections for a year afterwards. So just really kind of a lot of these underlying annoyances. A functional medicine doctor immediately said, oh yeah, you're estrogen dominant. You're this in terms of your gut, and you're not getting enough of these hormones. 3 months later, my wife is more healthy than she's ever been. So that's strike two. It's like, okay. So again, she's been to, and I went to med school here in Tampa. I know a lot of doctors. We never had to wait for an appointment. We always kind of went in the back end of the schedule, right? So it's like, okay, that's two that they've missed.
Yeah.
And then as I started to research, and I think this is most important, and actually this third strike was what really gave me the passion to create BioInsights. It was, of all those years of med school, we were always taught about lab biomarkers as being part of the objective evidence we use to make a diagnosis. In these laboratories, we were told kind of just three things. They exist in three states. Any biomarker, it's low, it's normal, or it's high. Fair enough, sounds reasonable. Really, there was no testing, if you will, or nothing that really sort of forced us as medical students at the time to know more about laboratories and their origin in terms of biomarkers. But functional medicine, that is sort of their cornerstone. And when you understand that laboratory markers were created from population statistics. So basically they take 100,000 people, and whatever that measurement is, 95% of them are considered normal, and three standard deviations from the mean on either side is 2.5%. That gives you your L and that gives you your H in terms of low and high. The problem is that it takes into account nothing about what is optimal. Right? It's kind of like going out and measuring the oil levels of 100,000 cars in Tampa, Florida, and saying, okay, this is what we're going to say is the manufacturing spec. So the normal amount of oil that should be, that would be the most ludicrous statement anybody would make. Literally, a user's manual tells you to the person who designed the engine on how much oil should be in there. It's not plus or minus. It is 5 quarts, 5.5 or 6, right? Well, the same thing is with a biomarker. There is an optimal range. That then to me crystallized the fact that a lot of all of these sort of diagnoses, the things that really bothered me the most was in medicine, where I think I sort of lost my zeal for it, was when you get into your third year and you're especially in the hospitals, you'll have these older doctors who will say, well, we used to use metformin for this, or we used to think this, or we used to think that. And the same part of my brain is like, well, what medical student were you yelling at 20 years ago for having something wrong? But now you probably should apologize. We're meaning your point of reference and what was truth has now migrated to something else. So then you ask the question, well, what am I learning today? Is it now going to be 10 years from now or something that you're going to apologize for what you just said?
Yeah.
So to me, to sum all of that up, it was a lot hides in normal for me, right? Meaning that providers have probably been misdiagnosing patients for 100 years, because if it's normal, that sort of data point from an objective marker is not even considered because it's normal. But in functional medicine, there's optimal, suboptimal, and above optimal. That's 95% of the population, right? And so when you're looking at all of these people, that would explain when they say, I don't feel well, or I'm off, or, I'm tired, or I have this brain fog. Functional medicine will glean that there is something going on underneath, right? There's smoke, there's fire. And that to me was then what technology are providers doing to know that. And I was shocked that there wasn't a lot of platforms, there wasn't a lot of technology to help providers really understand that something out of normal is just as valid, or something out of optimal is just as valid as something that was low or high.
And out of that birth, BioInsights was kind of your idea. There was a niche that was not being met, and it's really kind of a specific kind of thing. When did that idea kind of pop into your head? And tell me about kind of the birth of where that came from.
Yeah, so it was about 3 years ago as I was sort of thinking. So again, my background is when I left med school, but didn't complete my fourth year to go to residency. I literally went into technology and created the world's first browser-based electronic medical record, and a few years later sold that to Allscripts. So I recognized that there was a gap in technology in healthcare, and I love technology, but also loved healthcare, and I found a union, if you will, of those two. But in that space, I'm used to hundreds of competitors, and whatever I was doing, whether it was med device or whether it was EMRs or practice management, always had hundreds of competitors. When I looked in functional medicine, what I found was very different. Functional medicine is a lot of really passionate people who have great outcomes, but have a tendency to have a different sort of training trajectory. But more importantly, they're kind of like the Michelin chefs of the world. They create their own cookbook of really great meals, and then that's a military secret, right? And so many of these successful functional medicine providers out there don't share their secrets. And I was thinking, well, what if I went back and partnered with the provider that saw my wife, that'd been doing this for 17 years, and said, look, what if we created a clinical decision software that would look at symptoms, would recommend or give guidance on what labs you should order, and then basically take that data together and programmatically, using sort of predictive biostatistics, determine what is the probability of certain things going on from a cellular dysfunction perspective, right? Whether it's anemia, whether it's candidus, whatever it may be. And she loved the idea. And so to me, that was like, wow, if we could somehow liberate a really great cookbook, but understand that people don't have time to train for 10 years or for some multiple number of years, but if we could give them a piece of technology that would sort of be a co-pilot during whatever certifications or whatever sort of extra training that they're getting, that has to be valuable. And so literally then, is I think anybody on your show would be listening, I've come up with an idea. It sort of seems almost like apropos that you go then to, one of the engines for buying domains. It's like, okay, what's the name of this? And can I get the URL? And so I messed around with that for a few weeks. But it really occurred to me, and I was shocked that I could buy this URL, but it really is, when you think about our company really is about giving insights into biomarkers. And so therefore I just flipped the two words, and that's where BioInsights comes from. And so I was able to buy that. And then from my experience in the EMR worlds and passion about this clinical decision-making software, then I said, why don't we put sort of down the spine of the software as a workflow that will take in all these different inputs and give some guidance to somebody to really help what's going on. And then we'll wrap all the features and functions of an EMR around it. Then I think we would have almost what I would call sort of a functional medicine operating system, right? We would have something that you could run your whole practice on, but now the process of seeing people would be predictable, reliable, and scalable. And so that then I think really became the four corners 3 years ago for BioInsights.
So you're talking about linking all this information to an EMR, which for listeners, electronic medical record, where we use everything to have all the patient's data in the traditional setting, and have BioInsights kind of linked in to docs that, may want to use that as a different option for their patients, essentially. Is that what I'm understanding?
Yeah, I think you're exactly right. I think then the next sort of turn of the page of that is like, what segment are we going after? I mean, so who really? I mean, the world needs another EMR, like a person with
Yeah.
bad teeth needs another cavity, right?
Yeah.
I mean, you don't need one, but
Right.
functional medicine providers don't have a platform. There's a couple of EMRs that are out there I think have targeted this space, but I don't see that their functionality is different than your traditional sort of patient-centric design, or I'm sorry, documentation specific, right? And so EMRs were built really to streamline billing. I think
Yeah.
functional medicine, it's a cash pay basis. So that's sort of a foregone conclusion. So you're not really building something that's following sophisticated payer rules. You're building something in functional medicine to say, what is the root cause? How do I actually cure what is going on in such a way that I return a person to health, which is not really the end goal of westernized medicine. And by the way, for your users, I am not beating up on westernized medicine. I think very much so. There are millions of passionate people who want to heal. Unfortunately, it is the tools that they've been given and the training they've been given that I think that has handicapped their efforts in actually finding true health and wellness. But just kind of going back then to the platform, I think that in functional medicine, it is probably 10x more complicated than allopathic medicine because you're treating everything from the head down to the toes. And so there's a lot more data.
When I want to double tap, we're not bashing traditional medicine. And I've said before, if I'm having severe chest pain, I know exactly where I want to go, and I know who I want to see, and I know their door to balloon times are great, and all that kind of stuff. I mean, I have nothing but respect for that whole thing, but that's a back end kind of reactive approach that needs to be there. But yeah, there's a definite space for this, so that's why I'm so excited. But carry on, absolutely.
Yeah, and I would sort of underscore that in the fact that I want to market to and target providers who are disillusioned and frustrated. I want to bring those people that study to be gynecologists and cardiologists and gastroenterologists and all the other ologists that you can think of. And we say, look, here is a tool that will replace your EMR if you want to practice a functional medicine type of visit. And if you do that, then we have millions of lines of code that has been created to literally look for hundreds of things at any given time and come up with a probability scientifically that stuff exists, and then give you a pharmacy where you now have the ability to send compounded medications, where you have the opportunity for us to pill pouch things that create adherence. And so kind of having a full system to where you feel like, I think these mountains in front of these allopathic providers. It's like, wow, I got to think about supplements. I got to think about where I get them. I got to think about all these other things. Well, I wanted to have one solution that was customizable to allow for their ongoing education or what they have known in the past to now be operationalized in software now. So yeah, I think we both share a love for our providers who are out there. I think it's just now, and I think there's a great sort of time to sort of segue into the government. I think we are now we're in a period of time where, all of these sort of dissatisfactions with an allopathic or Western approach is now sort of seeing more policy that we are thinking about health. I mean, we're legitimately thinking about health and what does that mean? And so, first order of business was to get rid of these dyes that are toxic in our food supply, right? I mean, he sort of had this order of operations, and then he's gone after vaccines to say, hey, we should test these things before we put 72 of them in our children. And so I've been in DC many times throughout my career, and we were lucky to sort of make a case for functional medicine. But many people are already up there, but I think we're the only vendor that actually had the case. Like, maybe HHS, CMS. For your listeners, those are all 3-letter acronyms that basically control the checkbooks on what the healthcare is paid for by the government.
Right.
They should be giving functional medicine, root cause medicine, a seat at the table. And 2 weeks ago, they finally did.
Wow. Yeah. Speak more about that. I really wanted to dig in when I talked to you about that. We just didn't have time, but yeah, tell me about that experience. How did that go?
It was really great. And so, the actual journey sort of began, or, what led up to a couple of weeks ago began a couple of months before then. And so you really have, for the first time in history that's been recalled, right, that you have the head of HHS is aligned with CMS and is aligned with Medicare. And now you have this sort of digital service that runs right out of the White House that its sole purpose is to modernize government with new technologies. They're literally all singing off the same page, right? So one is that there's a massive amount of fraud, waste, and abuse. And so obviously DOJ was that sort of a center cornerstone of saying where's a lot of that going on. But in healthcare, we have, over a $3 trillion budget here in the US that the government writes checks for every year. And unfortunately, some are saying up to 30% of that is fraud, waste, or abuse. So we'll get rid of fraud and we'll get rid of abuse. So let's just talk about waste. And so where would waste come from? And so let's just say that's a third of the third. So we're talking hundreds and hundreds of billions of dollars. Sure. Is that if the Kevins in the world, or my wife in this instance, went from one provider to the next provider, provider B does not have the records of provider A. So provider B in their sort of decision-making algorithm needs to think, well, I need this test. I might need to do this procedure. And so if you do not have sort of the cumulative, decision-making and other assets that other providers sort of aggregated, you're forced to sort of go through this learning curve each time. Mm-hmm. And so that costs the government literally trillions of dollars. And so it was decided when Oz came in to head up CMS, he was obviously very passionate about health. He had tapped to work with the USDS and DOJ to say, okay, what is it that we can do to sit there and align technology such that we do not see all these providers in the dark, and most importantly, we don't see the patients equally in the dark. And so what they decided is they picked 60 companies. They invited us all to the White House to basically say, we're going to make health technology great again, or health tech. Yeah. And we were really excited. And so they picked several categories to which they felt were strategic. So one was the interoperability between these HIEs, which are basically just big data houses that sort of aggregate data. You can tap into that. Then they picked apps and a few others. And so there's one category that they thought we were uniquely aligned with in functional medicine. Is that basically diabetes costs the government about $1 trillion a year in the US, right? So that's with a T. So we've gone past the B's, and that's a massive amount of money. And so it was, what can we do to help take records, which, by the way, this Make Health Tech Great Again is all about each person within the next 12 months, especially starting with Medicare beneficiaries, will have all of the records on their phone. So they will now be the conduit between these providers and their EMRs to say, yes, I have all my medical records for me. Here, scan this code. And you as the vendor you will be required to now interact with the government and the health exchanges to pull that data into your EMR. So no more redoing tests. So Dr. B is now just as informed as Dr. A. And so we'll see, right?
Will this go, as we know, there are a handful of different EMRs, Epic to name one. There's a few that are more common. This will go between EMRs and be able to, without hassle or...
Yeah, I mean, kind of think of it as a digital wallet, right? A digital wallet that contains all your medical records, and everybody else is supposed to accept the wallet.
Right,
which I think is probably the best analogy.
Gotcha.
But they wanted one set of these vendors to basically be curative. Basically, they said, look, we want you to be involved in not just part of the ecosystem, that sort of the infrastructure, like a power company that sort of carries electricity across the nation, but we want some of you to really look at some of the diseases that are really costing the government a lot of money. And by obviously association, it's not particularly pleasant for the person to have the disease. So we were picked specifically about what functional medicine can do for diabetes prevention and treatment, of which functional medicine, we deal with that every day, right? And so especially if it's non-insulin dependent, that can be reversed with a high degree of confidence. And having somebody who is taking metformin and all the other conditions with, pre-diabetic and diabetic, all the organ damage that happens because of that. I mean, you're talking about really turning around the quality of life for potentially tens of millions of people, if not more.
Yeah, and that feeds into all the other disease processes. And I can't tell you the number of times that, you're in the ER and, there's somebody who comes in and feels bad and they're peeing all night and lightheaded and they've got blood sugar of like 300 or whatever. And and you ask them, did you know this? And it's like, well, last time I saw my doctor, my sugar was high. They just told me to watch it. And that's all the data and information they had. And no fault to the care. It was just the way it's set up. You just don't have enough time to sit down with people to kind of make those changes. So yeah, go on. Yeah.
Yeah. So, yeah, I think we're excited about that, obviously, and feel honored to be the only functional medicine company at that table, right? So, one of 60, and, we're sort of raising our little functional root cause medicine flag. But I think that, it is Oz and Kennedy, who have been on this functional medicine track personally themselves for decades, is now trying to get that into the government. So, clearly that excites us, and I'm looking forward to over the next 12 months of building out our infrastructure to accept these digital wallets, which will have these records. But we're going to take what's in that chart and we're going to give people personalized care plans from a root cause perspective, right? Okay, you have insulin insensitivity. How do we get rid of that? What's going on? What are the likely things that you can do? And so I'm very, very excited about our opportunity to sort of really treat, tens of millions, if not more, Americans. Not to mention this clearly, globalizing this is not a big uplift either.
Mm-hmm. Yeah, it's so you're taking all the medical records, you have it in a digital wallet, but also have a personalized care plan for that the patient has access to, easy access to, granted, and they can share that with their provider as well, and as another, adjunct to their care, essentially.
Well,
That's
that's what our software already does. So it's not a big lift, right? So if we already know that we know your labs and we know your symptoms, we already have the predictive statistics in the software. And so if you specifically even been diagnosed as diabetic or pre-diabetic, the system's going to give you a personalized care plan.
yeah.
That's what our system already does, but it also does it for 300 more things, right? And so to really carving off one of our protocols and basically giving a direct to patient access to that is not a big lift for us, but it certainly is, I think, the potential to truly be just magnificent. And so some of the other companies, Noom was selected as well, right? And so even Albertsons. I mean, so I think the government is doing a great job to try to look at the landscape of who can be agile, but legitimately stand up something in 12 months, not 12 years. But I love this fact that we're actually going to get records onto a person's phone versus, I think right now, one of the sort of death holds, especially, I mean, think about it, and everybody, I'm sure all your users know. So if you're being seen by a large hospital system and they say, oh, I'm going to refer you for a colonoscopy, they're always going to say, well, I'm going to refer you to someone across the street because he has your medical or she has all your medical records because we're using the same system, right? So this has been, I think, a very effective selling strategy for Epic and others that it says, look, as you branch out from the hospital to the ambulatory environment, you now sort of have a captive audience because you say, well, you don't want to go through that clipboard experience again with some other doctor, right? And so it really is sort of a soft leash, if you will.
Mm-hmm.
And that I think the government really says, this doesn't really sound like true capitalism, and for those of your listeners who remember something called ARA, I mean, the government, to their credit, back in 2008, 9, 10, paid $35 billion for every doctor to get a medical record, including the hospital. So I do think that they certainly had hopes that it was going to be interoperable between all of these installs.
I remember that time whenever we had forced changeover, and anybody who was in their 40s, early 40s at that time, got reading glasses. I mean, it just kind of popped over because there's all this time right on the screen instead of just writing on the chart. I remember that. 35 billion. Wow. I didn't know they spent that much on that. That makes sense. Dude, I'm excited about this. You're talking about changing the way healthcare works, or really empowering patients and physicians. I can't tell you the number of times I've talked to doctors wanting to even get into this space. They don't know where to begin and what do I learn? And this kind of puts some data into the hands of the right people at the right time. So it's, phenomenal. Yeah,
I think so. And kind of going back to my 3 strikes, right? I mean, our software would pick up a bad couch, and our software, understands different labs and it understands hormones. So I do think that there are perhaps millions of providers around the globe. It's like, I trained under this one sort of discipline. Where's the Sherpa to get me to the other mountain? I certainly hope that we continue to do a great job in understanding that market and how to sort of equip people, not to pull them out and make them go to school again, but how can we contemporaneously take, our technology, it also has embedded education, but as they now go back and say, take a course in bioidentical hormones or take a case in, gut microbiology and so forth. I think that, we have a good start. I think we have a great mission. And I think there are a lot of providers who say, I didn't really go sort of give up my entire youth, to go to undergrad, med school, residency, probably on their second or third marriage. I mean, these people have sacrificed quite a bit only to really being left with kind of, have you ever thought about it? At the point of care for allopathic medicine, only 4 things can ever happen. And you mentioned one of them, by the way. One is I'll give you a pill.
Yeah.
2 is I'll refer you to somebody. 3, I'll do a procedure or a diagnostic. And the 4th one you've mentioned, let's wait and see. Literally, there's only 4 tools in their tool belt. And so you have to sort of kind of almost be empathetic to this, for everyone involved in that exam room, because there really isn't a lot in a traumatic, right? So if you and I get hit by a car, I don't want supplements and I don't want to know my genomics. I really want to go straight to the ER.
Sure.
But all this other stuff that is creating sort of just really miserable health outcomes, I think functional medicine is something I'm so passionate about that I went back last year and finished my 4th year of med school.
I want to double tap on that. I love that about your story. It's like, I'll go back and finish the 4th year. How was that?
Needless to say, well, I wasn't of traditional age, right? And so it's like, okay, who's the old guy in the room? But, I did find a school that would accept 3 years in my transcripts and, passing the USMLE and all of that. And so I was able to find a program that was, flexible for me. But I think it really recognized the fact that I'd been disenfranchised many years ago. I was reinvigorated, and so much that I would do a startup and a 4th year of med school all at the same time.
Yeah. Yeah. Well, cool. Just such a cool story. And I love the innovation. And I just think this is, you're getting data in the right hands. I'm totally jazzed about this. And a lot of physicians, the whole functional medicine kind of thing is kind of a secret. You don't really talk about it, but what do I need to know about it? How can I help my patients? And I've met people utilizing some of this in their practices or trying to incorporate it because they want what's best for their patients, right? So what you're doing is, and you're empowering the average physician who's given up, like you alluded to, their whole 20s are gone because you spend all your time in that. And then you got to work fast because you got to be in this insurance-based model. You got to make patients happy. You have to, there's a lot of markers to make yourself a successful, good physician. But I think this will be an awesome tool belt. I think you're really changing things. And the fact that you have the year of the White House and that's super cool. You're doing cool stuff. This is great, Travis. I'm excited to see where this goes for sure.
Well, thank you very much. We're blessed, and we're going to be good stewards of this opportunity.
Yeah.
And can't wait to team up with providers and find ways to help to cross-train them and to start to heal.
Yeah. Well, are there any thoughts you want to leave us with, or anything else?
Well, I do. There's a couple things. One, I just want to say, and this sounds almost perhaps a little harsh, but I think passive patients in Western medicine have a good chance of becoming dead patients, right? Meaning that the longer that you're in the system, the more fragmented, confusing everyone is. And now the 3rd leading cause of death in the United States are providers. And so we need to recognize the fact that, as with my wife, I would be literally a widow now had we been passive. Had we sort of just hopped on the conveyor belt and allowed the system to sort of take us where it may, kind of like bags in an airport, we would have had a really bad outcome. And so I would just say that for everyone, regardless of profession, all of us will be a patient at some point. I think if you're not engaged, you probably may not have the best outcome if you sort of leave it up to people and just assume the system's taking care of you. If things would have happened any differently, I'd be widowed, and those 2 blue couches from Pottery Barn would still be there. We would never know, right?
Yeah. You're absolutely right. Passive patients really become dead patients. That is kind of harsh, but it's true. We're not passive about our cars. We're not passive about our finances. The only thing we're traditionally in has histories that we've been passive about is our health. If I'm sick, I'll go to the doctor. If I'm, this, I'll do that. And I think that's changing for sure. And then the fact that we are going to be giving them tools to help them not be passive, because a lot of times, patients don't know where to start if they're not educated on it. So yeah, this will be very cool to give them kind of a launching pad.
Can't wait.
Yeah.
Can't wait. And then we're going to tell their providers what's wrong with them and how to make them better. And we'll even probably give them a lookup tool to find functional medicine providers and what we would call geocoding in their area. So
Cool.
We look forward to this. I think it's going to be great. I have great optimism and expectation to see that vendors are being encouraged to break down these sort of data silos. And I'm really encouraged that now we have tools like AI and other systems out there that say, there's a way to treat this.
Yeah. So, Travis, how do people find you? And obviously, Bio Insights. How do people find out more? What's the best way to go about that?
Yeah, I think first off, our website, of course, so that's bioinsights.com. There's a link on there to book a demonstration or a call.
Yeah.
As well as information about what we do. Certainly people can email me directly. It's just my first name, Travis, Travis, at bioinsights.com. And I look forward to just any inquiries, but I also, anybody that just wants to shoot me an email and say, hey, have you thought about this or so forth? I think we're in a very sort of humble posture where we know that we're just 3-year-olds in functional medicine and we have a lot to learn, but that we really want input from other people and certainly open for any kind of collaborations that make sense and sort of pass the straight face test, as I always say. But ultimately, I would love to sort of see 5 years from now and people say, yeah, functional medicine runs on Bio Insights.
Yeah. Well, cool. Well, Travis, thank you for your time. I look forward to staying in touch, and I know I'll be seeing you next month. So I'm excited for the next steps for you guys. So anyway, thanks so much. I appreciate you being here.
Thank you so much. Have a great day, Kevin. Okay.
All right. See you guys later. Thanks everyone for listening, and we'll see you guys next time.